Good afternoon, dear students. Welcome back after the so called incomplete sessional examination. Uh, Today we'll be discussing about the last point, that is D point of third unit, prescriptions and medication orders. In uh, first year, I think you might have studied about prescription, types of prescription, parts of prescriptions, and many other things. Just an extension of the same, we have to study in this what it is and what is its importance clinically or in pharmacy practice. Uh, what different views of these prescriptions and medication orders. Let us discuss in detail about it. In introduction, we should know actually what both these are, prescriptions and medications orders. Both are actually different and both generally are said to be the primary means by which the doctors, who are called as prescribers, communicate with the pharmacist or the dispenser. The pharmacist or the dispenser, or who provides or dispenses the medications, about the preferred treatment for the patient. Through prescriptions and medication orders, actual communication about the proper way, called as preferred treatment for the patient, the disease which are there in the patients, okay, can be treated by means of giving some written orders, and which is the primary means. Okay, when generally when we say the patient is going to doctor or a physician, what the doctor do after examination, diagnoses the disease, and he decides a proper way of treatment, and which is mentioned in prescription or in medication order. Okay, hence we uh, can come to understand actually the pharmacist is not directly meeting the your doctor. Okay, through this prescription and medication order, the communication takes place between doctors, called as prescribers, and the pharmacists. Okay, the difference in these both, prescription is actually used for the outpatients. Okay, outpatient department, we have seen difference between inpatient department and outpatient department when we have studied the hospitals and types and departments, organization of hospitals. In for the patients who are not admitted, okay, also called as ambulatory patients, the prescriptions are used generally, whereas the medication orders are used when the patient is admitted in the hospital, which is also called as inpatient or institutional health system setting. So from this you can come to know what the difference in between. Before this, actually, Students are unaware about the actual difference between these both prescriptions and medication orders. Even the after studying also, pharmacist who has not gone through in detail about this, they are unaware with the difference. Okay, you should keep in mind and remind always up till you remain in the pharmacy field. Okay, difference between prescriptions and medication order. Prescriptions are for outpatients and medication orders are for the inpatient, even though both were having the inclusion of same what, the medicines, the ways of administering the medicines, okay, many other things which are there. So uh, both should be known to us. Further, these both prescriptions as well as inpatient orders are called as medication orders. These are actually the legal orders which are used, okay, for all the things we know when we are supposed to uh, give some instructions for the pharmacist, for the lab technicians, okay, or whoever is the medical staff over there, when what to provide, what to dispense if the medications or drugs are there, okay, devices if any are there, or which are the laboratory test, blood test, and different types of examinations needed to be conducted, different procedures like if we say the short operations, okay, even uh, other minor procedures needed to be conducted on the patients, like dressing if we say, okay, these similar sort of activities which are generally done in the hospitals by the medical staff, the doctor or the prescriber, okay, uh, used to give this either prescription or medication order, okay, and which is a legal order. Eh, there are different possibilities by which these orders or prescriptions can be found. Okay, it can be handwritten. Okay, it can be typed if it is having that sort of facilities. It can be pre-printed. Okay, verbal orally can also be given if there. Okay, we know nowadays even small hospitals are there, they are not always mentioning what sort of laboratory test they have to do. Directly they suggest that go to this XYZ diagnostic laboratory and perform the test for uh, what blood or urine. And they used to tell orally, okay, or directly. Even if we see, doctors call the nurses if the patient is admitted in the hospital, okay, they call the nurses and verbally they tell them what saline, or if they have to necessary for the patient, what saline is to be given, how much quantity, and what are the medications to be added in the saline, how many times. So these verbal uh, orders can be there, okay, medication orders if we say. Further, they can be even entered into computer program if they are having some software with them. Directly it can be submitted to the pharmacy by the patient, okay, after getting it from the prescriber or the doctors, or by the uh, friends or relatives of the patient uh, who are going there to get the medication or laboratory test done for the patient through computer okay, if they are having those facilities over there, okay, by fax or by any other additional electronic ways they can perform it. So there are many possible options by which the prescriptions or the medication orders can be given, okay, by the doctors to the pharmacist. Importantly, further, these can be for both type of drugs. We know prescription drugs or over the counter drugs. We are known about these both terminologies. What is the difference in between these both? So that prescription or medication order, it is applicable for both these types of medications, legend medication which are called as prescription, okay, and over the counter medications which are there. In case of these over the counter medications, generally which are determined by the FDA, Food and Drug Administration, to be safe and effective for use by the general public, okay, with not needed any prescription written by the doctors. Okay, we know about this OTC, whereas the prescription drugs are to be used only under the supervision of a practitioner, we know registered practitioner or the licensed doctor, okay. So this is known to us. Before again dispensing this prescription or medication order, it is the responsibility of pharmacist to analyze the prescription properly or medication order, to check the correctness, appropriateness, whether the prescriber or the doctor has mentioned the proper correct medications, whether uh, sometimes there are chances the doctor may have done some mistakes, okay, about the name, writing a proper name, or might be mentioning a proper dose, or might be proper what is route of administration. Many things are there, okay, or might have forgot to write about what with what material it should be. Material means before meals, with meals, after meals, or with milk, with water. Many other indications are there. So the pharmacist has the responsibility to check the correctness of the prescription or the medication order, okay, before dispensing, means before giving the medicines actually to the patient. The pharmacy, with his knowledge and skill possessed by them, they have to analyze it properly or evaluate the prescription properly. See what he has, the pharmacist has to do. He, the pharmacist should ensure the correct drug. First of all, very important thing, the drug must be correct one, okay. Further, dose or dosage forms which are there, okay, if for example uh, capsules, tablets, injections. So which type of patient, according to the condition of the patient, type of condition of disease, the appropriate type of dosage form should be mentioned in it. So the pharmacist should do it. The frequency of administration, route of administration, and then duration of the therapy, for how many hours, days, weeks, months, or years, okay, for how many period, how much period that medication order should be there. Okay, generally we know for many diseases pharmacist, the doctor mentioned that take this medication for 3 days, okay, or for 7 days, 10 days, 15 days, or for chronic patients they are mentioning for lifelong or might be in many months. So that is to be mentioned, or that has to be analyzed or evaluated by the pharmacist. Then indications, many indications are there, okay, has to be mentioned properly and to be analyzed by the pharmacist. Additionally, the pharmacist patient's profile which is mentioned, okay, in short sometime in the prescription or in the medication order, we know, okay, pharmacist profile, generally it is mentioning the name of the patient, age of the patient, and sometime the gender it is mentioned, okay. Many other things are actually there, has to be written or mentioned in the prescription or medication order. These additional things can be there, like that our profile should be checked for therapeutic duplication. Okay, there are chances. Therapeutic duplication means the medicines might be repeated in the same prescription, okay, of different brand. For example, if we say paracetamol, one brand, okay, again might be paracetamol or any other analgesic with another brand, which is called as therapeutic duplication. There are chances for the same uh, medicine, sorry, for the same disease you are mentioning two types of dosage or uh, drugs in the same prescription. So there are chances, okay, it may have some problems with the patient. Then drug allergies, okay, because the pharmacist, okay, generally not in our rural area or India, the pharmacists are knowledgeable about these things, but uh, legally or ethically the pharmacist should aware with all the details of the patients. So drug allergies, whether the patient is allergic with any type of drugs, should be known to the pharmacist also. Then drug disease state interaction, okay, what is the current state of disease of the patient and what drugs they are mentioned in the prescription. There are chances some interaction may occur. Sometimes the same drugs, okay, might have studied many drug interactions are there, okay. So two drugs mentioned in the same prescription may have such problems with one another, so it has to be again checked by the pharmacist. And laboratory data, if it is available, that again has to be properly analyzed or checked. Laboratory data means whatever lab test has been done, so depending upon the observation or the findings in the lab analysis, whether the medication mentioned in the prescription or medication order are proper or not, again has to be checked by the pharmacist. So what if it is done properly, it will facilitate to make the what is it will ascertain that whatever benefits are there of the therapy, okay, are maximized. Definitely, if you are checking the prescription, the medication order, each and everything in detail, whatever therapy which has been, that is way of treatment of disease, will be maximized. The advantage or benefits which are necessary to be got by the medications or by the way of treatment to the patient will only be there are chances it may be maximized if you are checking everything. If any mistake and you are making corrections in the mistakes, the therapy results, the effectiveness or the advantage will be increased. Along with another case, whatever possibilities of harm which are there, get toxicities or any drug interaction, allergies, whatever it may be, whatever are there, they can be minimized if all these things are checked properly by the pharmacist. What they will be checking? The again prescription and medication order in detail. Next thing, information required to be mentioned in the prescription. Okay, generally what are there? Okay, there can be some more things, but at least these things, okay, which must be present, or details about these points should be there in the prescription, written by the uh, doctor, or might be some assistant who is there with the prescribing physicians. Okay, see, easy things are there: name of the patient, name of the drug, strength of the drug, okay, in milligram or microgram or whatever it may be, then proper dosage form, okay, so whether it is injection, tablet, that is solid dosage form, or whatever it may be, depending upon the condition or the uh, way by which the patient can bear. Then quantity prescribed, okay, sometimes the doctor forgets to mention how much tablets, capsules, or whatever dosage are near to be purchased. Okay, 10, 2, 8, what it may be, the quantity should be properly mentioned. Direction for uses, okay, many directions possibly, if we generally say the regular direction only used in our area, okay, they are mentioning about the time of administration, okay, once a day, twice a day, thrice a day, okay, that 1-1-1 likewise they are mentioning like this. Okay, so direction, okay, morning, afternoon and evening, or before meal, after meal, what it may be, or at night, like that many things are there. Those are directions for use. Along with the information about the prescriber or the doctor should also be there, like name of the doctor, address of the doctor, and signature of the doctor or the prescriber, which can be called over here. The appropriate word can be used because it is a prescription, and who prescribing or writing in the prescription can be called as a prescriber. So details of prescribers are also needed to be mentioned. Okay, then sometimes you have to mention some additional information, like uh, if you want to write, okay, date of issue, then number of refills to be authorized. Refills means how many times that prescription can be again refilled. Okay, sometimes you are mentioning in that. Okay, then address and or the date of birth of the patient. Okay, because as per the requirement you need these things, not always. Okay, these things should be there, but hence they are mentioned, these are the additional information. Okay, then the prescriber's uh, number is there, which is called as registration number in India, while drug enforcement administration DA number, generally it is a number mentioning some alphabets and the numericals, the combination of it is there in United States. Okay, so the number registration or license number, we know the doctor's registration number should be there. Okay, these are additional information. So in case of the medications which are having which are called under the category called as scheduled substances or controlled substances, there are more strict guidelines or rules and regulations which are called as for mentioning or writing them in the prescriptions. So along with all the just I told, okay, these information, you have to also mention many other things, okay, about the controlled medications if they are to be included in the prescription. Okay, in case of the patients which are called as pediatric patients, okay, or the doctors who are engaged in the treatment of children for their different diseases. So in that case, additional thing is there called as a patient age and patient weight, because in case of these children, oh, the calculation of doses, we know, okay, there is a formula depending upon the age of the children, okay, and weight of the children. So hence it is must in the prescription, if it is for pediatric patient, the mentioning of age of the patient and weight of the patient should be written without forgetting. And if the doctor is for animals, okay, veterinary doctor or veterinarian, they should include the animal species, okay, in which treatment is to be done. Okay, because from species to species, that is from animals to animals, the medications and many other things are changing. Next is the medication orders. Okay, in case of medication order, the information which is mentioned, it is nearly similar as that of the prescription. Okay, many things are same, but some things which are an additional needed to be mentioned because it is for inpatient. Okay, uh, let us see in detail what are needed to be mentioned in it. First, name of the patients, okay, a secondary identifier, means to fix, okay, or to have the confirmation whether the patient is same, because there are chances by the same name there can be uh, patient, okay, having same names, okay, in the same hospital, there are chances. So additionally, if this case is there, okay, they are also mentioning the date of birth to make it a proper identity of the patient. Then medical record number, okay, we have seen what is medical order, so that medical order number should be there. Okay, one more thing which is called as social security number. Okay, this social security number is again having some specific numbering. Okay, nowadays it is obsolete or less in use. Then further, location and room number. Location of the patient, why? Because it is admitted in the hospital, so in which ward, what is the room number, whether it is in ICU, whatever it may be, the location of the patient should be mentioned in the medication order. Then time and date of order definitely should be there. Okay, and other things which are common with the prescription, like drug name, dose, route of administration, frequency and duration of administration, and definitely at last the prescriber name and signature, that is the name of the doctor and the signature of the doctor along with the dates, if it is there dated signature, it is good. So this is exactly what difference between the a prescription and a medication order. Okay, Further additional things are there that we will be discussing in our next lecture. Thank you. Take care.